What's going on, everybody on YouTube? This is Christian Brindle, and today I wanted to give you some last-minute advice, in my opinion, on kind of what I would recommend for people going into the annual election period. Right now, we're about mid-September, but starting October 15th and going through from October 15th through December 7th will be the Medicare annual election period, which stands for AEP for short. Basically what this is, folks, is this is the Medicare enrollment period where people on Medicare can make changes from one plan to another. More specifically, you can make changes from a Medicare Advantage plan to another Medicare Advantage plan, or you can go from a Medicare Advantage plan back to original Medicare with a Medigap and a drug plan, or you can go from a Medigap and a drug plan over to a Medicare Advantage plan, or you can go from one PDP, which stands for prescription drug plan, a drug plan, to another prescription drug plan. It's basically like a free-for-all, folks. You can pretty much do whatever you like and whatever you want to do when it comes to making changes. You know, it's the time of the year to do that. Now, that being said, even though you can't make a change until October 15th, the madness really does begin, in my personal opinion, for people on Medicare, October 1st. And the reason for that is because that's when the advertisements come. That's when you're going to start seeing commercials. There's even certain insurance companies that have an entire hour-long television show going on during basically the whole month of October and the whole month of November. So from October to November, you're going to see those shows going on. You're going to see commercials. You're going to get things in the mail from pretty much every single insurance company you've ever heard of, and a bunch on top of that you haven't heard of. You're going to get mail from all different kinds of agents and brokers and different people in the insurance industry. You're depending on who you are. If you've ever filled out any type of information on the internet or sent in a reply card or anything like that, you're going to get bombarded by phone calls, most likely. And some people even have people knocking on their door, which is, in the Medicare world, if you're doing that, in a lot of cases it's highly illegal. So people that do that just aren't very intelligent. But it just depends, folks. It just depends. Now, my advice, and if you don't know who I am, I'm the host of the Everything Medicare Podcast, which is probably the most popular podcast on the internet that has to do with Medicare. If not number one, it's definitely number two. I've written 2 different books on the topic of Medicare. The first one being the ever popular Medicare Guidance, Picking the Plan for You. I'll leave a link down to that in the description if you'd like to check that out on Amazon. But basically, folks, I'm someone that also owns a company called Christian Brindle Insurance Services, and we're an independent insurance brokerage where we work with people on Medicare of all different situations, and we partner with all of the largest insurance companies in the industry. And our agenda is to help somebody find the best program that fits their needs and preferences specifically. Just because Medicare is not a one-size-fits-all type of situation. If you've been following me for some time, you know this. Medicare is something that needs to be specifically picked out for each person specifically. So my advice for people going into the enrollment period is simple. I would say understand what your choices are before you make a decision as far as to change something. Because if you're on a current plan now and you're looking at another plan, first of all, you need to know what your current plan is changing to for next year. Make sure that you know that. If you have a Medicare Advantage plan, look for something called the annual notice of change that will come in the mail, which comes from your insurance company. It will come before October 1st, at least it should. And the annual notice of change will take a look at your current plan. Now, this is if you have a Medicare Advantage plan. If you have a Medicare supplement or something else, or like a retirement program, you won't receive one of these, so don't expect to. But if you have a Medicare Advantage plan, which many people do, look at your annual notice of change, because the annual notice of change will compare the changes this year going into next year, and they'll have them side by side, and it'll make it extremely simple and easy for you to understand. So my advice would be to take a look at that book, understand what your plan is changing to. Because let's say you don't like your plan this year for some reason. Let's say it doesn't have dental, but then next year your plan is adding a tremendous amount of dental benefits. Well, that solves the problem. Let's say you like everything else on the plan. So it'd be a pity to change over to another plan that might have dental, but let's say it doesn't have everything included into it that your current plan has, that you like about it. So you're trading one problem for another. Make sure you know what your plan is changing to next year. And on the flip side, on the other side of the coin, let's say you're on a plan that you really like, you have no problems with it, but if you don't look at your annual notice of change, then you have no way of knowing if it's going to be good going into next year. They could take away a lot of benefits that you really cherish on your program. So you have to know what, number one, what your plan is changing to. Number two, understand the plan that you're looking at and kind of what its good and bad is. Because I don't care who you're talking to, and if you're talking to, like, let's say a slippery insurance salesman, I'd like to call them, because they usually like to tell you all the information up front. Make sure you're getting the good and the bad information. And if they're not willing to give you the bad information, go talk to someone else, because someone else will. I guarantee it. Every single program you can look at has good and bad to it. So make sure you're getting both sides of the coin before you're making that type of decision to change. On top of that, folks, evaluate your needs, run your prescription coverages, make sure that whoever's working with you is running your prescription coverages, because every single Medicare plan has what's known as a formulary. Formulary is a list of thousands of different medications. And in the Medicare world, they sort the prescriptions in categories. These categories are called tiers. So you have tier 1, 2, 3, 4, and 5 in most cases. 1 being the lowest, 5 being the highest. The lower the tier, the lower the copay. The higher the tier, the higher the copay. So you're going to see a lot of different plans, whether it be a Medicare Advantage plan or whether you have a drug plan that goes with your Medicare supplement. This is going to be the model across all of different types of Medicare plans, depending on the different type of plan it is, but they're all going to follow that same model. And so 2 different plans can take one prescription and they can both categorize them in different tiers, and that's going to affect your copays dramatically. So make sure that you're having your prescription plans compared before you make a change. And my advice, folks, is simple. You just want to make sure that your plan is going to be good next year, and if it's not, make arrangements. And if there's a better plan available, make sure that you're not being so closed off to it that you don't want to look into it, because it's important to understand this stuff, but you don't want to blindly jump headfirst into a program without knowing everything about it, because chances are there's a good opportunity that you might not be able to get off of it going into next year. Hope this video helped out quite a bit. If it did, please do me a favor, drop a like on this video and subscribe to my channel for future videos and Everything Medicare Podcast videos and other types of educational Medicare videos that we will continue to be pumping out during the enrollment period. Thanks so much for watching. I hope you have a great day. Take care.